Well, hi everybody. Today I'm going to tell you about a public health problem that will absolutely blow your mind, not necessarily because of how serious it is, although it is serious, but because of how simple it is to fix. So even if this doesn't affect you personally, and it never will, I guarantee you this is going to blow your mind. Right, Molly? And so this is the star of the show today, No Mouth Molly, and you'll find out why she's the star of the show in just a couple of minutes. So if you think about all the major public health problems like poverty or obesity, they're not that easy to fix. Now, you might be a simpleton and saying, well, just tell people to eat less, but believe me, that is not going to solve the obesity issue. But here's a problem, sexually transmitted infections, that could be easily fixed without anyone changing their sexual behavior at all. All we have to do is educate physicians and definitely online STI testing companies to do things a little bit better in a way that makes more sense. Right, Molly? Molly? Oh, there you are, Molly. Come on, let's go. And of course, I can prove all of this with real clinical data, meaning clinical data from both studies, peer-reviewed studies, which I'm going to show you in a few minutes, and also from our own clinic. I can also prove to you just how big of a problem this is. As a matter of fact, right now, I'm driving Molly over to a doctor who bumbled this so badly, in my case, that I'm officially referring No Mouth Molly to him. So what exactly is the problem? Well, No Mouth Molly back in the back seat there, she's the ideal patient for most physicians and definitely all online testing companies because she does not have a mouth opening. As a matter of fact, she could be patient of the year. So what we're talking about today are sexually transmitted diseases, also known as sexually transmitted infections, and namely we're talking about gonorrhea and chlamydia. Now, gonorrhea and chlamydia are extremely common. About 5% of sexually active young women in the United States right now have chlamydia. That's how common they are. But the critical thing for you to understand is that they are site-specific bacterial infections. There is no blood test for gonorrhea and chlamydia. You have to collect cells from the area of the body where you might be infected. So yes, your genitals can be infected, and that is what doctors nail 100% of the time. Doctors know that you can do a genital swab or you can do a urine test. What they're not really good at thinking about all the time is oral sex. And because of that, statistically, and I'm going to show you a study on the screen right now, which shows that between 18 to 36% of gonorrhea infections are missed on an STI screening. I actually think that's underplayed because I own an STI testing company where 80% of our gonorrhea infections are oral only, caught with a throat swab. So without a throat swab, 80% of those positive gonorrhea cases would have been given negative gonorrhea test results. So that STI testing company where you order your 10-panel test online, or you do this, you do that, do the other thing, is it actually going to tell you if you have a gonorrhea and chlamydia infection? Okay, No Mouth Molly, we are here at a doctor that is the absolute appropriate one for you. Now, the last time I was here, I got an STI test. And the doctor did not even know what a throat swab test was. And I argued with him, and he finally figured out how to order it. And then he sent me to a phlebotomist down in the basement. Now, this phlebotomist was a really nice lady. She definitely was not young. I could tell it was not her first day on the job. I imagine she spent decades as a phlebotomist collecting samples right there on the first floor of that building. And she told me that she had never even heard of a throat swab test before. And she absolutely refused to do it. Now, you can only imagine in a large medical building like this with dozens of doctors, how many thousands of STI tests have been completed over the years, and apparently not a single one has ever had a throat swab test included. And so there are millions of dollars spent every year on STI testing from private insurance companies, Medicare, Medicaid, or even people doing self-pay. Very, very few of those are testing the throat. And like I said earlier, they're missing between 18 to 36%, or in the case of our patients, as high as 80% of STI tests. Okay, well, we're just going to go ahead and leave Molly here because she does not have a mouth opening, so this place is going to be able to STI test her perfectly. Well, anyway, the point here is that you have to be gonorrhea and chlamydia tested in all three locations, or it is not a valid test. And if more physicians knew that, and definitely if these online STI testing companies would straighten up a little bit, we can certainly go a long way towards eliminating a lot of infections. So now what about these online STI testing companies which only test the genitals, which is basically all of them? Well, your guess is as good as mine why that is. They either are unfamiliar with oral sex, they're unfamiliar with basic biology, or it could be that they're just trying to keep the cost down because they know if they can put an ad on Instagram saying, find out your chlamydia status for $99 and it's just a urine test, that is ultimately going to sell better. And they are sales companies than a test that costs 3 times as much that's going to test people's throats as well as their anus as well. But I believe that the general population, when they buy an STI test, that they think that is going to indicate if they have an STI or not. And if they see gonorrhea and chlamydia on the package, well, they think it's going to tell them if they have gonorrhea or chlamydia. So I think we can solve this public health issue by physicians, these online testing companies, and everything like that. For heaven's sake, test people in all the areas that they could have this, because people have oral sex and people have unprotected oral sex more than they even do any other type of sex. And so throat swabs are absolutely key. I'm Robert from Shameless Care. Thank you so much for watching.